I started here at Water Street in 2020, and early on, I remember having conversations with my supervisor, Jean Benedict, in regards to how folks would come in seeking shelter, and a lot of times we had to say no because their physical health need was too great for shelter.
It is heart-wrenching. Knowing that someone is going to return to their car and try to navigate some rest and recovery is really difficult. It really does move you with compassion to say, hey, what can we do about this need?
We were able to make that need known, and leadership was very responsive and acknowledging, hey, this is a way that we want to love our neighbors better and more strategically. This group of folks that don't need to be in the hospital, they're medically clear, but they're also not able to navigate Providence shelter.
As we began researching, what we realized is that here in Lancaster County, there really aren't services where the person can get the care that they need, but have a safe place to sleep and to live for the short run.
We continue to look at the data in our emergency room in terms of, who's visiting and are there things that we can do within the community to make sure that the emergency room is used for true emergencies. As we looked at our numbers, we see that almost every week there are people that we are ready to discharge from the emergency room, but there is some minor care that is still needed. Right now, that's not something that we have available to people within our community that are experiencing homelessness.
There's a national body that put together data on just how cyclical it can be for someone who is unsheltered. They're addressing their physical health for a short period of time, and then they're discharged and back to square one. Medical respite is helping to kind of stop that cycle by addressing as much as possible while someone is recuperating. And so we can help connect them to all of the social services, get all of the points of coordination aligned so that it really helps simplify things and is less overwhelming.
We see this as just a huge part of being able to provide dignity and respect to those that are marginalized or are the most vulnerable in our community during this time in their lives.
Thank you all for being here to mark this occasion. The needs are clear in our community. There are so many of our neighbors who are struggling. We've seen it with our guests here through the years, the growth of our health services division. But this next step of recuperative care is such a key need in our community. With our mission statement, which I want to share with you, it's in response to Christ's love, we join with His mission to walk with our neighbors who are experiencing marginalization and poverty, trusting Him to transform lives and restore hope. We know that this population, individuals with medical needs, who are unhoused, are one of the most marginalized in our community. We have an opportunity to walk alongside of them, and ultimately it is about hope. It's about restoring hope in the lives of those that we're going to walk with in that season. And we're so grateful to have the chance to do it through these rooms that we've established for phase one of recuperative care. And I'm just reminded that this wouldn't be possible if it wasn't for God and the work that He's been doing in Water Street, and it wouldn't be possible without the supporters of Water Street who have a heart for their neighbors. So we're grateful for our supporters who have made this possible. We're grateful for our partners in the community, and we're grateful to God for this new gift that we'll be able to share with our neighbors in need.